We will explain about allograft. Allograft means transplantation of cells or organs to a recipient who is the same species but has different genes of donor. Transplantation from other part of the body to the another part in the same person is called autograft, and transplantation between different species is called xenograft. Transplantation between two people who have the same gene, this is called isograft.
Today, examples of the use of transplantation technology include kidney transplants for people suffering from end-stage renal failure and hematopoietic stem cell transplants for people suffering from tumorigenesis of blood cells and immunodeficiency diseases.
We will explain about some of the major medical problems associated with allografts. There are two major problems, HBGR,縮主体移植変反応, and GVHR, 移植変体縮主反応. These two reactions form a counterpart that, as we will see later, is based on the origin of T cells. To understand HBGR and GVHR, let us talk a little about HLA. HLA stands for human leukocyte antigen, which is a protein found on the surface of cells. T cells use HLA to determine whether a cell is self or non-self by recognizing HLA. So let us look at HBGR first. HBGR stands for host versus graft reaction. It occurs when donor's tissues with the HLA different from recipient's one are transplanted. When the recipient's T cells recognize the HLA of the donor's tissue as non-self, the T cells attack the tissues. Next, let's look at the GVHR. GVHR stands for graft versus host reaction. It occurs in bone marrow transplants performed on patients with leukemia, 白血病, or congenital immunodeficiency syndrome, 先天性免疫不全症候群. It occurs when T cells produced from the donor's bone marrow recognize the various tissues of the recipient as non-self and attack them.
GVHD can be divided into acute and chronic. Acute GVHD affects the skin, liver, and gastrointestinal tract and develops within a few weeks of transplantation, with symptoms such as skin rash, diarrhea, and jaundice. Chronic GVHD, on the other hand, affects the skin, oral mucosa, lungs, and eyes, with symptoms such as stomatitis, dyspnea, and dry eyes beginning about 3 months after transplant. One of the most common problems in transplantation is rejection, which is when the patient's lymphocytes attack the graft as a non-self. Both rejection and GVHD are prevented by immunosuppressive measures such as drugs like tacrolimus and whole-body radiation. 1 in 10 patients may develop hepatic central venous occlusion as a side effect, and most patients can be treated symptomatically with diuretics because the condition is not that severe. However, if the condition becomes severe, defibrotide, which has only recently been approved in Japan, must be administered.